MilfordMD, Richard Buckley, and team here. Remember, this morning's project was Lipo-Abdominoplasty. So we numbed the abdomen. The patient's actually been sleeping. I was going to tell you she's awake, but I mean, it's all done with so-called tumescent local numbing. Our patients are always awake for everything we do. But then again, they're so comfortable, they fall asleep. Are you awake now?
Mm-hmm.
Yeah, you know, you were snoring a little bit.
Not surprised.
Not surprised. Okay. So that's what happens when you're comfortable and, right?
Yes.
You're not nervous at all?
No.
Be kind of late anyway, because the procedure's done.
It's done.
Yeah, it is.
I'm
Not that you would know. I mean, you're comfortable, yeah.
Mm-hmm.
Yeah, not that you would know it's done, because you haven't been that much help, actually. Yeah. So we numbed the abdomen, and then we sucked out, you know, like a bucket and a half of fat. So our patient is actually much slimmer than she was before. And there was a so-called pannus, or a hanging bit of skin here. I showed you in a prior episode that there was fat wide open where we took that skin off. I told you don't watch it if you don't like graphic. But then again, you might go and have a peek, you know, that's like a little peek. So it's quite a bit of skin that we're able to take off by the time we're talking about maybe doing a tuck. And then we did tailor tacking. You remember we used some, you know, tailors use pins, right? They hem up the gown, or they figure out the sleeve length, the cuffs, etc. I use these, they're little towel clamps. And we clamp the skin that I propose to take off, meaning that's what I mark. Seems like it will come off, but we make sure that we can put it back together again. That's actually the important part, is how it looks in the end. So tailor tacking helps us ensure that that's going to go back together, and it always has, always does. But we always check. So most of the time I don't put in a drain. Sometimes I do. We put in a little bit shy of 1 gallon of numbing fluid in our patient's abdomen today. So I thought it worthwhile just to put this little tube that hangs out. Tomorrow I'll just slide it out. I see people for facelifts and some eyelid surgery and brow lifts and tummy tucks and breast dog and arm lifts and thigh lifts. I see those people the next day in a recheck, and so she'll be here tomorrow anyway, and I'll just slide that out. What it helps to do is to get some of the numbing fluid out more quickly. Normally, if we just do lipo, we'll make a couple little poke holes down on the bottom so we can get our small tools, you know, like this, through the skin. I need some little poke so we can get through the skin. But when we've done an abdominoplasty, I don't really typically leave any poke holes, so there's no place for any of this numbing fluid to additionally drain out. So it's nice to have the little drain in there for a day. Sometimes, most of the time I don't do it, probably 95% of the time I don't do it, but occasionally. So it's lipo-abdominoplasty. That hanging skin is gone, the skin is already tightened, and it's going to get really, really even flatter as this numbing fluid gets absorbed by the body. And so you'll have an amazing result. Already looks amazing. And thank you for watching another episode of Milford MD.